Hello, my name's Ann Vickers. I am a speech-language pathologist, a massage therapist, and a certified craniosacral therapist. I wanted to make this video for you, Mom and Dad, and any lactation consultants that wanted some pointers on how to deal with some oral, muscular, fascial issues of the face and mouth for babies. So I'd like to start that with talking about the lacrimal gland. So sometimes the tear ducts get clogged. As you know, the tear ducts are right there, and it's a little bally thing that you can feel. So I'm going to show you a few techniques on how to unclog the tear duct. So the first one would be to use your index finger, and if the baby's so small, you can use your pinky, and you're going to make contact. So you're not going to slide, you're going to make contact and pull towards the forehead. And you can do that 3 times. And then I want you to pull towards the nose. Again, you're not sliding, you're making contact and pulling. And then go towards a downward V. Then you can use 2 fingers. So with baby, you might have to use pinky and index. So you're going to go towards the forehead and stretch, towards the nose and stretch, towards the V and stretch. And you're going to do that on both sides. Then the third thing I'm going to show you is a lymph drainage technique. And when you do lymph is just right under the skin. So if you go farther than that, you're not on the lymph anymore and it's too far. So very, I'm going to use this, I know it's getting irritated. I want you to make contact very light as you can feel contact. And then I want you to go into that V again. So 1, 2, 3, 1, 2. 1, 2, 3, 1, 2. 1, 2, 3, 1, 2. Again, don't slide it, pull it. So that's the tear duct. The next thing I want to tell you about is the TMJ joint. So your maxilla is part of the skull, but your mandible is a jointed bone. So it's connected at the TMJ joint. So here's your cheekbone, and here's your mandible, and then right in between is that joint, and it has a little ball, and so there's the jaw, and there's the TMJ joint, and sometimes it slips out, or sometimes the muscles around it are so tight that baby can't open his or her mouth very wide. And so the first thing you want to work on is the muscles. The temporalis muscle is a gigantic muscle, and so that's the first one that you want to work on, and that I just do this with baby. All up into the top of the head too, behind the ears, in the jaw. Then the masseter is a smaller muscle. It's more compact and thicker, and it really just closes that mandible jaw. So that you want to do a little bit deeper, and you want to do some rolling on it. And you can do this at the same time with baby. Okay, the third part is you want to feel the jaw, and then here's your cheekbone, and here's all this soft tissue. Start going back towards that little V, and then it'll start changing. It'll get a little harder, and then you know you're on the bone when it's really hard. So get into that harder part and find the other side and do it too. Trace back, trace back, trace back here. And then you're just going to make contact and pull. And you want to hold this as long as baby will tolerate it. So it takes longer to really lengthen tissue. It's short to stretch things, but then the stretch reflex takes it back. So you want to lengthen it. And the longer you can do that, the better. So 90 seconds is a really good amount of time. But if baby will only tolerate 20 seconds, do 20 seconds and then do it again a little while later. But you're pulling gravity, you're pulling weight down. And you want to do it at the same time so that you don't make baby's jaw cattywampus. One's loose and one's tight. If baby came out of the womb with a crooked jaw, you pretty much can guarantee this is the tight side. So this side might need to be worked longer. But in general, just do this technique and hold it and lengthen it and lengthen it and lengthen it and lengthen it. Okay, let me put my glasses on to see what I wanted to tell you next. Okay, so we're going to work about the lips. So there's all kind of wonderful, fun things to do with babies, and you can take pictures while you're doing this. But we want to get this area looser. So sometimes it's due to tongue ties, and sometimes it's just due to tight musculature. But you want to get your index fingers and push and make the fishy with the baby. And you feel on yourself how that's stretching. So right where the corners of your lips are, push And if you'll do that 3 to 5 times. The next one is right under your nose. Make contact and push down. Don't slide. Contact and push. And do that 3 to 5 times. Then you want to do the chin. Make contact and push up. Again, 3 to 5 times. This one is my favorite one. I call it the scissors or the seesaw. But again, you're making contact. You're not sliding. You're making contact and you're pushing. And do that 5 times. The other is coming around the top of the mouth towards down. Do that on both sides. And then come up. And do it on this side. All right, the next thing I want to work with you on is the inside of the mouth. So let me put a glove on. And we're going to work on the tongue for just a minute and the frenulums. So you have a little frenulum at the top of your lip and another frenulum at the bottom. Sometimes babies are really tight and they can't even close their mouth. Sometimes the tongue tie may be farther back in the tongue. So we're going to work on a little bit of it. You can start with just pulling the lip down for baby. If baby tolerates that, then you can take that index finger or your pinky, depending on size of baby. Take your teeth, go all straight down from your teeth to the frenulum. Even on me, it feels like a great stretch, but if your baby is very tight, this may be uncomfortable for him or her. So you do what you can. It's best to wear a glove, but if you wash your hands really good with soap and water, then you can just do that with baby. Let's do the top now. So again, you go to the teeth and just go straight up and then kind of roll out. Straight up and roll out. Same with the bottom. Straight down and roll out. Okay, so next we're going to go to the cheek. Sometimes there's ties on the buccal area, which is called the cheek area. So you take your finger, and again, baby, you may have to use pinky, straight up and trace the cheek. If it's tight, you'll feel it. It won't budge. But you can just stroke it and come back the other way and go to the other side. All right, so next part is the tongue. And if baby has a tongue tie, they probably will not like this technique. But remember, just a little bit of gentle stretching several times a day will do the job. So you want to come straight back into the mouth and then scoop into the tongue. So I'm going to do it on my left side first. So you see what I did? I went straight back and I scooped into the tongue. The longer you can hold it, the better. 10 seconds would be great if baby lets you do it longer. But again, if you have a problem, baby's not going to like it. Let's do the other side now. That side's tighter on me. Now, while you have the glove on, you might as well do this too. You want to grab the inside of your cheek and the outside of your cheek, and you're just going to stroke. And then you can, then you can stroke down. All right, so that concludes our little oral facial stretching and exercises. I hope this helps you. Have a great day.